Hello everyone and welcome. Today we're diving into the world of asthma. This common condition affects millions of people. Asthma is a chronic respiratory disease. Chronic means it's ongoing. Asthma affects your airways. These are the tubes that carry air in and out of your lungs. When you have asthma, your airways can become inflamed. This means they swell up. The muscles around your airways can also tighten. This makes it hard to breathe. Asthma can range from mild to severe. Some people only have symptoms occasionally. Others experience them regularly. Imagine a straw. Air flows easily through a straw. Now picture the straw being squeezed. It's harder for air to pass through. This is similar to what happens during an asthma attack. The inflammation and tightening of the airways restrict airflow. This leads to the common symptoms of asthma. What causes asthma? It's a combination of factors. Genetics play a role. If a close family member has asthma, you're more likely to develop it. But genes aren't the whole story. Our environment also matters. Exposure to certain things can trigger asthma or make it worse. Some common environmental triggers include allergens like dust mites, pollen, and pet dander, irritants such as smoke, pollution, and strong fumes, respiratory infections like colds and the flu. Asthma triggers what sets it off. Asthma triggers are different for everyone. What bothers one person might not affect another. It's important to identify your personal triggers. Common triggers include dust mites. These tiny creatures live in dust and can be a major problem for people with asthma. Pollen from trees, grasses, and weeds can trigger asthma symptoms, especially during certain seasons. Pet dander. Even if you love animals, their skin flakes or dander can trigger asthma. Mold. Mold grows in damp places and releases spores that can irritate the airways. Recognizing the symptoms. Asthma symptoms can vary. Common signs of asthma include wheezing, which is a whistling sound when you breathe, coughing, especially at night or early in the morning, shortness of breath, feeling like you can't get enough air, and chest tightness, a feeling of pressure or squeezing in your chest. Treatment options. Breathing easier. There's no cure for asthma, but it can be managed effectively. The goal of treatment is to reduce inflammation in the airways, prevent and relieve symptoms, and help you live a normal, active life. Your doctor will work with you to create a personalized asthma action plan. This plan will include medications, with inhalers commonly used to deliver medication directly to the lungs, and lifestyle changes like avoiding triggers and making healthy choices can help manage asthma. Living with asthma can be challenging, but it doesn't have to control your life.